Hello everyone and welcome to my channel. Today we are gonna comment Dr. Stefgan's video which has title "The chopper broke during surgery, now what?" The surgeon in this video is me, that I had the terrifying moment to have a broken chopper intraoperatively and the way I manage it. We start with a second side port with the main incision. We are dying, we're waiting for 30 to 40 seconds in order to visualize the anterior capsule, and then we are washing it out with viscoelastic. We are ready with a Utrata to do the capsulorhexis, the curvilinear capsulorhexis. We are doing a small rhexis at the beginning. At this moment I felt that it was not so tenseful, so it was not in edematous, so I started directly with the capsulorhexis. It was circular, curvilinear, nice and controlled. We are doing a little bit of hydrodissection, hydronucleation, and then we are ready with a stop and chop technique to do the phacoemulsification. With the second instrument, we divide into two segments, and then we are ready to aspirate the one of the two. And then with the chopper, we are subdividing in the anterior chamber the segments in order to lower a little bit the ultrasound that we are using, in order for the procedure to be more safe. As you can see, it's brown. So it was not only a white cataract, it was a white dense cataract. And now we are coming to the main part of the video. This is the moment that I touched with a probe, with the tip of the probe, the chopper, and it broke while I was coming out from the side port. And here is it. You can see it is near the iridocorneal angle, in front of it, above the iris. And when I'm taking out the chopper, I can see the second instrument inside the anterior chamber. At this moment I felt really terrified and I was thinking, what should I do? So the first thing was to fill up the anterior chamber, the bag, with viscoelastic, in order for the tip of the chopper not to go back to the bag. And I'm placing the chopper again back to the iridocorneal angle in order to take it out. And then in order to take it out, I used the Utrata. And while I take it out, it's also stuck at the main incision. Here you can see it again. And safe and easy, I'm taking it outside. Then I'm placing the IOL inside the bag. I'm washing out the viscoelastic with the IA. And then I'm ready to do the edema to the main incisions and to the side port. So let's comment a little bit what the cataract coach said from the beginning. He said that this is why we can see that the resident is operating. That's why the eye is going in front, in the back, and it's not center. In order for a new resident to have the eye center, he needs more than 200 to 300 cataract surgeries in order to be able not to press the main incision or the side port and have the eye center. But the other comment is that in the district hospitals in Greece, we are not using anesthesiologists or retrobulbar injections for cataract surgeries. That's why the patient has also the ability to move its own eye. So that's why the eye was not centered. The other thing is that cataract coach is not using choppers from steel, instruments in general from steels. He's using instruments from titanium, which cannot break so easily, because as you saw in the video, I touched with the tip of the probe the chopper and it broke directly. The other thing is about the eyelashes. It was super correct. The drape was not in the correct place, and I had the difficulty in order to see the side port at this exact cataract surgery. So he agreed again with viscoelastic, that it was good that I placed viscoelastic in the bag in order not to lose the tip of the chopper. He said also that he would put a big wave of viscoelastic in the iridocorneal angle. I was not sure that it was in the iridocorneal angle. That's why I shared with the chopper. That's why I also traumatized the iris. This was a mistake. Maybe it should be better if I place a wave of viscoelastic in the iridocorneal angle in order for the tip of the chopper to come up again. The other thing that cataract coach said was that the posterior capsule could be broken by the broken tip, because it was sharp I can agree with this. The really important part that I didn't do because I didn't have the time, I didn't have the thought at this time, I was super terrified in order to find the second part, was when I took outside the part of the chopper, was to put them back together with the second instrument in order to see if there is another part also remain inside the anterior chamber, inside the eye. So this was a really good point. I want to thank again Coach Cataract for including me on his website, and thank you very much. I hope you enjoy.